question is to the Minister for Health. Minister, the Chief Medical Officer's recommendations to prevent another major COVID-19 outbreak were to fix the structure and resourcing, the process and the culture of hospitals. The Director of Public Health's top two recommendations relate to the resourcing and management of infection control needed to create a culture of safety. Culture is set by management, by the THS and ultimately by the Minister. It's clear before the outbreak that this hospital was under-resourced. The Auditor-General's report on the performance of the four major hospitals in 2018-19 also found the THS urgently needed to implement a cultural improvement program. Minister, today's front page of The Advocate shows staff at the North West are afraid to return to work and they need reassurance. While Tasmanians wait for a vaccine, will you take responsibility for inoculating the state's hospital system to prevent such COVID outbreaks in the future?
Thank you. The Honourable Minister for Health.
Thank you, Madam Speaker, and I thank the Honourable Member for her question. I'll go to the end of your question first. And first of all, as the Health Minister, I always take absolute responsibility for the actions within the health system. And I'd like to thank the hard-working staff for what they have done. On the ground, the nurses, the clinical staff, the admin, the cleaners, they have all been working incredibly hard. Ambulance Tasmania over the preceding few weeks, particularly on the North West Coast, transporting patients to the LGH, who has been standing up again to be able to take those patients. We're seeing the Mersey Community Hospital taking on board more patients, as well as staff being deployed from the south. So firstly, I want to thank those staff members for what they are doing. They are working incredibly hard, not only to deal with this outbreak that we have, but also ensure that we have maximum preparedness across our entire healthcare system during this pandemic. With regards to the North West Regional Hospital, as with the other areas of our hospitals, we have been implementing pandemic escalation plans over the past weeks and months. So this has been part of our planning to ensure that resourcing is deployed to different areas to ensure that they have maximum preparedness. This work is continuing. We're ensuring that additional capacity is applied around the entire state to ensure that they are supported. With regards to the North West in particular, we have seen, since coming to government, 50 more nurses deployed there. We've seen 8 new beds. We've seen capital investment across the North West Regional site as well as the Mersey site. And we've also employed more paramedics across the North West. So we have been responding to need across our entire healthcare system since coming to government. And since we raised to a public health emergency, it was only last month, we have put additional resources both in the emergency management structure, both on the ground in terms of resourcing, but importantly, as was raised by you, infection control and PPE, so that we have implemented at those sites the measures to support staff to make sure that they fully understand and have the support to be able to use PPE appropriately and feel safe about coming back to work. It's also why during our coming back to work procedures we have initiated a training program so that staff are retrained in PPE. This provides also confidence with the further support staff that will be helping with that in the buddy system that we've got. We're also testing all staff before they come back, and we know that over the last 2 weeks have also been conducting a deep clean of those sites. So I want our staff to feel confident and I want them to feel supported. The entire healthcare system is working to be able to support them. We've seen that over the last 2-3 weeks as we have seen those measures that have been taken at those hospital sites, and I thank those staff. I know it has been incredibly stressful on them, their families, the patients and the broader community, as well as those other hospitals that have taken an extra burden because of this. And I'd like to reassure all Tasmanians, but particularly those on the North West Coast, that I will take whatever measures I can as a health minister to ensure your safety.